Tonight, a union is taking aim at HCA Healthcare system, which runs 3 Valley hospitals. The union says the healthcare provider is choosing profit over patients. Fox 5's Drew Andre outside Sunrise Hospital. And Drew, this is far from the first time we've heard of staffing shortages at hospitals in the Valley.
The union says staffing at HCA hospitals, which includes Sunrise, Southern Hills, and Mountain View, is 34% lower than the national average. And a report released this week by the Hospital Association shows the problems persist beyond just these 3. Desert Springs Hospital announced this week it is closing hospital operations, in part because of staffing issues. That eliminates 282 beds and 34 in the ICU. The study done by the union SEIU found that 80% of frontline workers at HCA hospitals around the country have witnessed patient care being jeopardized by short staffing. A longtime pediatric nurse at Sunrise Hospital told us that's what she's gone through.
You did your best, and your best wasn't enough just because there wasn't enough of you. And that's really demoralizing. And unfortunately, we've seen lower retention numbers. People aren't staying. It's scary sometimes what you're responsible for and what you need to do to keep these patients safe and how little time you have to do it.
Despite these stories from nurses, the local affiliate of HCA Healthcare says they disagree with the union's allegations and tell us the reality is, against the backdrop of a national nursing shortage exacerbated by a pandemic and continuing patient surges, our staffing is safe, appropriate, and in line with other community hospitals and applicable regulations. Now, the pediatric nurse says they saw these staffing issues coming heading into this winter. When they were asked what would be done about it, they were told by upper management that they were in the process of hiring more people. I'm Drew Andre, Fox 5 News, local, Las Vegas.
Desert Springs hospitals, which are not under the HCA healthcare system, will stop all inpatient operations in March.